Hi, I just came back from a trip to Spain. Now that sounds good. And it was good. My wife and I had a good time in Spain, but that wasn't the reason we went. I actually took some training in a procedure that we've been doing in our office for the past 4 years called plasma-rich growth factors. We've been using the technique for the past 4 years, and the purpose of this trip was to study with the person who developed this technique, who is an oral surgeon and physician, Dr. Eduardo Anitua, and that was in Vitoria, Spain, which was in the northern part of Spain. Great course, and there were people who were taking the course from all over the world, and it's just nice to be able to interact with people like that. It was very exciting because the fact that we can extract just a little bit of blood from your arm and get the growth factors out of the platelets that are part of what you donate allows us to mix those growth factors with your bone grafts, with your soft tissue grafts, and make them heal much better and much faster. And some of the documentation that he had a tremendous research institute. Here's a dentist who has a staff of 300, and it isn't just for patients. He has a research institute that is looking at the literature, that is doing the biochemical studies and the pharmacological studies to be able to look at this product that we're creating called PRGF and see how it can be applied. It was just tremendous. And the applications don't just start and stop with dentistry. In fact, this is being used now in orthopedic surgery to help tendons heal faster. So for sports medicine, people are able to get back to training much faster than they would if PRGF weren't used to repair the tendon. It's being used in other parts of orthopedic surgery, and it's being used now in facial rejuvenation. Not yet approved in the United States, but it's being used all over Europe with lots of successful results. Imagine facial rejuvenation without using a foreign product, but instead just using your growth factors to not just fill in the areas of wrinkles, but actually make them heal. Very, very exciting. So we've been using PRGF for the past 4 years. He's developed some new equipment to allow us to be able to use PRGF even better for your soft tissue and your hard tissue grafts. What does that mean for you? It means that the implant can go in faster. The implant is ready to be restored faster. That we may not have to have as much of a delay for bone grafting and implant placement. It just means we get from start to finish a lot faster as a result of this fantastic development. The second thing I did was to go and visit a family of dentists who have developed an implant. This is an all ceramic implant. Let me show that to you. So this is the CeraRoot implant. CeraRoot implant was developed about 9 years ago, primarily for people who are sensitive to metal or want to have a metal-free restoration in their mouths. So this is made out of a ceramic called zirconia. It's very strong. Essentially, the implant, using the zirconia implant or the CeraRoot implant, is done almost the same way as a regular titanium implant, but notice it has the tooth portion of it, or the crown portion of it, attached to the implant. So essentially what that means is that the procedure is done all at one time. The implant is placed, and this little thimble, which is used to support the crown, is placed. And I'm sorry, Courtney, I shouldn't have moved. Is that better? So there's a crown, or a thimble, that is custom made for the CeraRoot implant, and the laboratory bakes porcelain on that and makes that look like a tooth. We've had patients coming in from other parts of the state, because I'm the only surgeon right now in Florida who's placing this. We've actually had calls from people out of state for more information about this. So for those of you who are concerned about metal-free, who are looking for that kind of an implant, we've now placed a few of them. They've done very well. They've healed up beautifully. There's no history of any fracture with this kind of implant, and it has a similar success rate to the traditional titanium implant, which of course has been around for many, many years. Any questions about either of these things? The PRGF, enhancement of bone grafts, or this ceramic implant called the CeraRoot implant, just give us a call. Look forward to seeing you again soon.